And in preparing the segment today to discuss mutation testing and talking with a number of colleagues in the profession and also people that have helped put this segment together, many women have expressed to me that they cannot understand why somebody would not want to have this information, and that knowledge is power, to know your risk. But not everybody feels that, do they?
No, they do not. We often hear through force of people who are, you know, choosing not to get genetic testing, and there's a variety of reasons. So some people may not even qualify for genetic testing, and that's something that a genetic counselor would walk through that process with the individual. But some people feel that the knowledge of carrying a mutation would be so overwhelming in their life and cause so much anxiety.
So like a time bomb waiting to go off.
Exactly, that they choose not to do testing, and instead those people then just do increased screenings, and with the plan to catch cancer in its earliest, most treatable stage, and then they feel comfortable with that, and they don't ever have to know if they carry you know, the genetic mutation. There's other people who are worried about genetic discrimination, and it's important for them to know that there are laws in place. The Genetic Information Non-Discrimination Act, also known as GINA, protects people. It's a federal law that protects people against employment discrimination and also health insurance discrimination based on their genetic results. For some women and men too, age is a factor. You know, if they're very young and they've realized that they may have this mutation and they have a strong family history, they may decide to wait several years until they decide to go through testing, and those people also then just do their increased screenings.
It seems to me that to you, when you went for this testing, they were kind of already preaching to the converted. You decided that you wanted to
yes.
proceed. Did your siblings feel the same as you and as strongly as you from the beginning?
Yes, we all felt the same way.
And all of you proceeded to undergo testing?
Yes, we did.
And how soon after doing the blood test did you get results?
So for our family, we were actually going through a research study at Fox Chase Cancer Center, and this was back in the early 2000s, and so our results actually took 6 months to come back.
Wow.
And nowadays it's just a couple weeks. So for us it was really a long process, which isn't the case anymore. You know, till we went in and did our testing, it was 6 months until we got the call that the results were in.
And of you and your siblings, how many tested positive?
So my 2 brothers and myself are positive, and I have a sister who tested negative.
And when you learn that information, you learn that information together, do you?
We did all go together for our results, although the genetic counselor did call us in one at a time to give individual results, and then also reviewed what the recommendations would be for managing the risk. And then we did all come back together at the end of the session, and we met as a family and talked about it again.
So after 2 hours of counselling prior to having those blood tests drawn, did you feel that by the time you got the result that was obviously positive, did you feel that you'd been adequately counselled? And even if you did feel that you'd been adequately counselled, how did you actually process that information once you got the actual confirmation that the result indeed was positive?
So I really felt confident going into the testing that I had all of the information, and especially watching my aunt go through her diagnosis and treatment and learning, you know, as we discuss things as a family. But quite honestly, when you're sitting in the genetic counselor's office and she says your result came back positive and here's what we would recommend, you know, it is kind of a blow. And it did take me a bit of time to process through that outside of the genetic counseling office. I had chosen to do 2 years of increased screenings before I was ready to do any other type of surgery or anything else, just so that I could have time to learn, you know, everything that I needed to know and feel confident in my decision.
And of you and your siblings, does anybody have any regret about proceeding with that test, knowing that the result that they got, or are all your family members glad that they have that information to move forward to decide on treatments?
Yes, all of our family, my immediate family, my siblings, we all feel very confident and no regrets with testing.
Through your experience with FORCE, your professional experience, have you ever spoken to people who've actually regretted having the test, positive or negative result?
I can't say that I've heard of a negative experience. I have heard of some women who tested at a very young age, and further years down the road, they did mention that they wish they would have waited a little bit longer until they were more mature or ready to make another decision, because then they kind of sat on all of that information for several years, and that was a little bit of an anxiety situation for them.
And before we learn a bit more about the mutations from Dr. Secord, patients who are having this blood test, it's not just about the result. It seems to be that the counselling that comes before, during and after is so important in helping patients process the information that they're given and the emotions that go with that. Is it fair to say that most counselling centres that are offering this test are trained in making sure that the counselling that's given is appropriate and extensive? Is that fair to say?
Yes, I would say that's fair to say. We really recommend, FORCE really recommends people to see a certified genetic counselor, and they are absolutely trained to give not only the information, but they also can help you through some of that emotional support as well on the other end.
So you've never heard the situation where a patient has attended for a blood draw without any appropriate counselling and then has been given the bombshell, yes, you're positive, but they've not had the appropriate counselling on the front end?
We do hear a lot of situations where women get a genetic test and it's not through a genetic counselor. They haven't had the counseling prior to their testing, and they receive this positive result, oftentimes over the phone. That could be through a primary care doctor. And they just say, oh, your results came in and it's positive, and they don't even understand what that means. They have no idea. We're fortunate that they find FORCE usually online and then contact us, and then we're able to support them and educate them and help them along with the decision-making process, or at least get them to a genetic counselor who, even though they have their results, can then process through some of that information.
And we'll definitely come back to talk a bit more about the testing and the financial considerations of this test and insurance issues in a moment.